Welcome back. Thanks for staying with us. You're watching Ozarks Tonight. I'm David Oliver. We've been talking a lot during the pandemic about other healthcare issues we have to continue with despite COVID-19 now being a major part of our lives. One of those health areas is our eyesight. We're joined here on the broadcast tonight by Dr. Shahar Taber. He's the lead physician for Mercy Eye Care here in Springfield. Dr. Taber, good to see you, my friend.
It's good to see you and hear from you. I've missed you.
Well, we started doing some segments with you in January and February about eye health awareness, and then the world kind of changed and we kind of got away from doing that. But just because we're in a pandemic doesn't mean that people should be neglecting their eye health. Talk to me a little bit up first about how you all are kind of still conducting your business during this ever-changing pandemic that we're in.
You're absolutely right, David. The pandemic has definitely changed the way we approach things. You can see my mask is always around my neck when it's not in front of my nose when I see patients. So during the early part of the pandemic, we realized that there were some patients that we had to see, those who were injured, those who had infections, and those who had some acute changes in their eyes, pain, loss of vision. So our clinic was always open. We always had doctors on call. We had patients that we knew we couldn't push out an indefinite period of time. So we had doctors here and we socially spaced the whole waiting room. And we basically made sure that temperature controls. And so no one with any symptoms would come in and everyone would be masked. So I really want to give a kudos to Mercy and Jennifer McNay. Dr. McNay really put together an incredible system here, as well as the infectious disease group. Fortunately, as you know, we're not seeing what my poor mom is seeing in New York City. We've been blessed a little bit by not getting nearly the amount of issues. But our patients are concerned, and so we opened up the clinic to allow them in. A lot of us started doing things like we're doing now, using telemedicine to come into the patient's home. So I looked at my transplant patients and had them go over medications. We did eye charts. I got to see them read a lot of different magazines of different tastes. It was quite interesting, and it's really going to teach us something going forward on how to take care of patients. But as things got better in May, we started seeing some changes. We were able to bring more patients in. We started doing our routine elective surgeries, meaning cataract surgeries, meaning surgery for children. So I just came out of the operating room. We did cataract surgery. I did transplants. My partners did glaucoma surgery, and my other partner did pediatric eye surgery, so the eyes were straightened on these little kids, because you can't let that go too long. And we're grateful that we have a system here. We have the Greene County Board of Health has done an incredible job of keeping us safe, and patients are starting to come in, and we're learning how to see them well. So, you know, just coming out of the OR today, I'm very pleased that the safety of our patients is number one, and we're not losing touch with them. You remember we talked a couple of months ago about glaucoma and needing to have follow-up care and to be looked at because sometimes it can sneak up on you. Same thing with diabetes. Well, we want those patients to know that we're here for them. It's safe to come in and get the eye exam done. The only inconvenience that you'll be done is you'll get a temperature check and you'll wear a mask. But for us as surgeons, we wear masks every day we operate. So for us, it kind of becomes part of our garb. And I got to say, we're grateful that our patients have such trust in us as physicians to come in. We're grateful for the staff that cleans this place up and makes sure that it's sanitary and is safe for patients to come in. So little by little, we're waking up nicely. Our operating rooms are working. Our nurses are doing an incredible job. They truly are the heroes.
You know, let me ask you, because, you know, you and I have talked before. I mean, I think a lot of us, including myself, I use my eyes to make a living. And a lot of us take our eye health probably for granted, and yours truly is included in that. And it's something that we probably shouldn't take for granted, especially this time of year too, because we're entering a time of year when folks are going to be outside a lot more in the sun, but also we're coming into the 4th of July season. And I know that's a time when ophthalmologists like yourself really offer warnings to people in terms of eye safety, right?
Absolutely. So you remember a couple of months ago, before this virus set in, we talked about eye safety and we brought those cool protective eyewear. That's really the important thing. That will protect you from an eye injury, as it does for people who work, at work, and people on the farm. So if you're going to participate in fireworks, obviously the most important thing is to enjoy yourself and your family, and let the professionals show you a beautiful show. They're trained to do this. Their safety is number one priority for them. But if you're going to participate at home, think about it. If it doesn't light, don't check it out, okay? Because it may explode as you're approaching it. And unfortunately, our July 4th keeps us very busy. I don't leave the ER for a couple of days, and we have at times run out of space to see patients in the waiting room because injuries do happen. We're getting better over the years. People are starting to understand this, but unfortunately, in my heart, there's always going to be a tragic story that comes in July 5th or 6th. Having looked down into a bottle rocket that didn't explode, or a Roman candle didn't explode, and then it ignites, and you're catching a lot of pressure built up and a lot of heat.
Okay.
Things such as something as simple, David, as a sparkler, which looks beautiful, and you'll see little children hold it. That sparkler is burning magnesium, which is 1,600 degrees.
Yeah.
It really isn't the burn you want.
Yeah.
So safety is important.
It is very important, and we're running out of time here. I wish I could talk to you more, but I'm going to invite you back here in the next few months as we keep a focus on our eye health. Dr. Shahar Taber, the lead physician for Mercy Eye Care here in Springfield. Good to see you. Good to have your information. Be well, and we'll invite you back soon, okay?
Looking forward to it, because I got to show you, I brought you a cool toy. I don't know if you can see it back here, but this device that I'm wheeling up to you is our new device that is going to treat people and prevent them needing a cornea transplant for certain diseases.
Well, that's a tease.
So I want to talk to you about that.
That's a tease for our next interview. Dr. Taber, thanks so much. More Ozarks Tonight after this quick break.